Welcome to Bluff Medical Center. Today's purpose is to help you prepare for your joint replacement surgery. You should have received a joint replacement binder that can be used as a reference during today's discussion. As you prepare for your joint replacement, you will be hearing from some of your healthcare team. Examples of your healthcare team would be your surgeon, an anesthesia provider, a nurse, rehab staff, social service, and others as needed during your hospital stay. You and your support person are also very important parts of the team and have ownership in your surgery. On the day of surgery, you will need to register at the hospital front desk. You will be directed to the day surgery department where you will meet your OR team and prepare for surgery. After your surgery is completed, you will spend a brief time in recovery room in the OR department. After the recovery room, you will then go to the acute care. Your length of stay will depend on how well you progress after surgery and your discharge plan. Once in acute care, the staff will continue to monitor you frequently and do your vital signs often. There will be a few new things present after surgery. You will have some supplemental oxygen via nasal prongs for up to 24 hours. A Foley catheter will be in place to drain urine from your bladder, which will be removed by the next morning. Your surgeon will prescribe medication and/or use equipment to assist with blood clot prevention. Examples of the medication would be warfarin, Xarelto, Eliquis, or aspirin. The equipment places compression on your lower legs to assist with blood return to the heart and thus preventing blood clots. During surgery, there is some blood loss and your surgeon will monitor your labs to ensure that you are not becoming anemic with low red blood cells. If you do become anemic and are symptomatic, examples dizzy, lightheaded, low blood pressure, the surgeon may possibly order a blood transfusion, although not the norm. Your hospital room is a private room with its own bathroom. The hospital bed has controls in the handrails for operation of the bed. Each room has a call system and a handheld control that you can push to get assistance. Each room has a phone for local calls and a TV with basic cable. Wi-Fi is available for devices to be used in the hospital. It is normal to have pain after surgery. Our pain scale in the hospital is a range of 0 to 10, where 0 is no pain and 10 is the worst pain imaginable. Anesthesia will discuss your pain management plan with you and will make adjustments following surgery. Each patient needs to be able to perform necessary tasks and be able to function with the pain, and thus the term used is functional pain. Each patient tolerates and rates pain different and will be able to function at different pain levels. You will have pain medications on a scheduled basis and also on a as-needed basis, which is given when the pain affects functional level. When your pain is elevated, you can ask for this as-needed medication. Ice packs may also be used for pain control. Constipation can also be an issue after surgery. A change in diet, a change in activity, having nothing to eat or drink prior to surgery, and taking pain medications can increase the chance of becoming constipated. In the hospital, staff will encourage intake of water and juices as well as any medications ordered by the surgeon to help prevent constipation. Acute care staff will have you sit on the edge of bed and dangle your legs after surgery. This is to prepare for the work with therapy and to see how your body reacts and tolerates the change in position. Once therapy works with you and states safe to ambulate, then you are encouraged to be up in the chair for every meal and walking to the bathroom when needed with assistance. Later, you will hear more about rehabilitation's role in your exercise plan. Preparing for discharge starts before you even arrive for surgery. Make sure your home is safe and ready for return after surgery by repairing floors, carpets, cords, and such. Have a plan for animals in-house as to prevent tripping hazards. Have functional stairs, rails, and ramps if needed for when you return back home. Your discharge from the hospital either to home or rehab facility occurs when you are meeting discharge criteria, which includes tolerating a diet, off IV fluids and IV medications, pain is controlled by oral medications, and you are successfully meeting physical and occupational therapy goals. When discharged from the hospital, you will need to watch for signs and symptoms of an infection, which may consist of significant increase in pain at surgical site, new or increased redness or swelling or warmth, new or increase in drainage from incision, elevated temperature, shakes, or chills. These would be reasons to notify your surgeon or seek medical attention. Thank you for your time and choosing Mount Bluff Medical Center for your care, and look forward to seeing you after your joint replacement.